Yes, I think I've been following some of the views that have been expressed. I think basically the views are coming from the fact that those individuals that have contributed so far, be it clinicians or indeed clinical scientists, they are looking at it from a perspective where a drug or indeed a vaccine has to pass through all the clinical trial phases, meaning through phase 1 to phase 3. Of course, you know that phase 4 is basically surveillance when the vaccine or indeed the drug is already, or the medicine is already on the market. I think I would rather approach it from a different perspective. While I appreciate that phase 1 clinical trials usually involve health participants, that is human beings. And of course, there are some circumstances like in the clinical trials for anti-cancer drugs where you can use the patients themselves. In this perspective, really, we are looking at a disease that you either get it and die, or indeed you survive. And in such a scenario, it will be folly for us really to start looking at a scenario where the vaccine has to go through clinical trial phase 1 up to phase 3. I'll give you an example. In this case, if you look at maybe the Russian vaccine, although most of the individuals are saying what were conducted were phase 1 clinical trials. Let's imagine the phase 1 clinical trials that were conducted involving maybe close to 100 individuals, because usually in phase 1 clinical trials you have about 20 to 100 individuals that would participate. Imagine that those 76, all the 76 mounted an immune response, and all the 76 had the antibodies, which were neutralizing antibodies. There is what we call in clinical trials altruism. Altruism is basically a moral principle that is practiced by human beings, where you sacrifice for future generations. It's a principle which looks at selflessness versus selfishness. And this is a scenario where an individual would put himself at risk, even at the cost of their own lives, to actually sacrifice for the benefit of the future. So if we had such a vaccine, we have such a vaccine which has neutralizing antibodies, and medical personnel are dying. Those that are above 65, 70 are dying. In my view, there is nothing wrong with those individuals being given that vaccine. It would be of benefit, just like what is done in some cancers which have no medication, vaccine on the market. I mean, there's nothing wrong with immunizing individuals that are at risk. Here we are looking at either saving a life or indeed losing a life. And if you look at maybe African countries, how many African countries are engaged in research? Or indeed, most of these vaccines and drugs that are brought, or medicines that are brought on the African market, how many of the African countries do conduct bridging studies so that they can evaluate whether these medicines or indeed vaccines can work in an African population? So I believe so far new. All areas of intervention should be tried. And if there are scientists locally that are looking at a locally based solution, that should be encouraged. And you see, this is one thing that in Africa, across Africa, governments should be doing. They should invest in research. We are doing very little of research. Imagine if maybe countries abroad, China, Europe, and so on, were not conducting research on our behalf. Even malaria. could have been an issue now. Coartem was not, discovered in Africa or indeed in the sub-region. So there's a lot that governments can do in investing in research, which is not the case in most of the countries. You look at Zambia, for example. We have the Sondage formula. The Sondage formula went through phase 1 clinical trials, and it was supposed to progress to phase 2 clinical trials, but it has not been funded. At one time when I was at the National AIDS Council as chair for treatment, care and support, Dr. Sondage even accused me that I would be one of the people that are actually blocking success of his medication. So it's worth trying if people are dying. There's what they call fast tracking of a drug or indeed a vaccine if it has shown potency. What I'm saying is that people are dying. We are just lucky that in this sub-region, maybe because of biodiversity, we are not dying as much as in Europe. And we should consider ourselves lucky. So if there's such a vaccine, basically I would tell you as a physician and as a public health specialist, it's worth trying it to save life. I'm one of those individuals who believe in altruism. Mm-hmm. You sacrifice for the benefits of future populations. I'll definitely go for it.
Okay. Well, thank you very much, Brigadier, for joining me.